From the beautiful Finger Lakes region of upstate New York, this is the Dental Lighthouse Podcast. We take questions from anyone in the dental profession and discuss what it takes to win not only in dentistry, but in life. Business, leadership, relationships, parenting, health and wellness, money management, nothing is off limits on the Dental Lighthouse Podcast. I'm Jason Tanoory, your host, and have over 20 years of experience to pull from. Learn from my mistakes and let me help you collapse time so you can become the best version of yourself. Next on the Dental Lighthouse Podcast, we have Janice from New York. Janice, welcome to the show.
Thank you for having me today.
Well, thank you for being here. How can I help you?
So I have a question about compensation and employees coming to me asking for an increase. We have a philosophy that we would like to pay our staff on the higher end of what the industry pays. And so that to me, when, say, for example, Mary comes to me and says, hey, I feel like I deserve a raise. And we always say we're compensating on the higher end in our area. How would you approach that?
Super good question. Janice, are you a doctor, an office manager? What's your role in the dental practice?
I am an office manager.
Okay, so you have team members. Let me just create some context here. You have team members coming to you just saying, hey, I deserve a raise. And you're struggling with how to manage that conversation.
Yes, we do have a salary tiered system for our dental assistants, so they know what tasks or procedures they need to know and really own, can do it well.
Right.
But then so I'm asked to train more, or I'm the go-to person when no one has the answer. So
right.
It doesn't really fall into our salary tiers.
Right.
And I don't want to upset them by saying, you're already making enough money.
Right. Okay, cool. It's a super good question. Very relevant. And I can share with you my thoughts and what we practice in our organization, but obviously things are going to depend on your philosophy and where in the country you're practicing and stuff like that. So let's go over a couple just general rules. Similar to you, our philosophy is we want to pay our team members on the higher end of the range that they deserve. Now, that's a very ambiguous statement. And as you know, I hate ambiguity. So let's unpack that a little bit more and try to get granular with it, a little bit more objective. So there's lots of ways to determine ranges, low end, medium, and high. You can use resources like salary.com, Glassdoor, Indeed, a lot of Job Monster, a lot of these websites. You can get a little bit of clarity on what high ranges of pay is and what low ranges of pay are for a specific position and for a specific area. For dental assistants in our area, a brand new assistant, let's say brand new, unlicensed, uncertified, used to be a barista at Starbucks, is going to come into our organization at about $18 an hour versus someone that's been with us or in the profession for 25 years and has a tremendous amount of skills. They could be all the way up to $30 to $35 an hour. So that's a pretty wide range. So our philosophy is we want to pay on the high end of that range, but that doesn't mean that we're going to pay someone that has no experience $35 an hour. So you had mentioned the tier system, and I think that's a really good framework to use where you have tiers of skills or tiers of competencies. And for tier one, it could be stuff like able to take diagnostic x-rays, able to pour up an alginate model at a certain level of competency and efficiency, able to break down a room and set it up for a root canal. Those are tier one things, right? So tier one compensation could be $18 to $21. Tier two competencies are able to pack cord, able to make a temporary crown. And that pay is $21 to $25 an hour, and so on and so forth. So you go all the way up the tiers. So that's a really good reference point to have clarity on where someone should ultimately be paid. But it's definitely not the only thing that you should be looking at. And it sounds like this particular assistant that's come to you might be falling outside of those tiers. So what are some other things that we need to consider? Well, if they're taking on responsibilities that are above and beyond the tier system, you had referenced that this particular individual trains a lot of new people, then they should be compensated for that. Now, how they should be compensated is ultimately up to you as the office manager and the doctor that's leading that practice. It could be an increase in hourly pay. It could be a lump sum check during the training process. If they're training continually, then it should most likely be an increase in hourly. Like, for example, training could be considered a tier 3 phenomenon. And if someone's training consistently, then you would pay them tier 3 wages, because training goes into the tier 3 level. So is that starting to kind of resonate with your situation?
Yes, it is. It is. And it's just hard to put a dollar amount to specific, like the training. For us, training isn't going to be like every single day. It ebbs and flows. So throw a suggestion at me. What dollar amount would be right to just give them for that intermittent training?
Yeah.
What's fair? Like, where do you get that fair number from?
Super good question. And everything's negotiable, right? But if you're a growing organization and you are really leaning on this person to train, and they train at a high level, then that's worth additional money.
Sure.
I was just on a call with someone who was asking a similar question, and it's kind of the same thing. This particular person that you're referencing is wearing multiple hats. So they wear the hat of chairside clinical assistant to whatever doctor they're working for. And for that, they should be compensated. But it sounds like they're also wearing the hat of dental assistant trainer. And that's a different hat with a different skill set and a different level of responsibilities. And in my opinion, they should ultimately be compensated for that as well. Now, is that a 1 hour a day job, or is it a 8 hour a day job for a month? Depending on the answer to that question is going to dictate the level of compensation that they should ultimately be awarded. Just throwing out a number here. If I had a dental assistant that was going to take a new hire under their wing, train them up, allow them to shadow them, it would probably be worth anywhere from $250 to $500 in additional income on a monthly basis. And if whoever is training balks at that, then a negotiation is started. Because this person definitely needs to be compensated, but as the office manager of the practice, or as the owner of the practice, if you're the doctor, you need to be fiscally responsible. Because if you're making decisions that are not in the best interest of the practice financially, then you're basically running the profitability into the ground, and there won't be a business to train new hires in, because you'll be broke. So that dichotomy of this, if this is a great core value fit, they take on a lot of additional responsibilities, they feel like they need to be compensated more, great. Do that. But if they're already at the high end for their skill set and they're already getting compensated more for what they're doing, then just paying them more because they're asking for more is a fiscally irresponsible thing to do.
For sure, for sure. And do you think it's helpful for me to explain that to Mary, that fiscally this isn't going to work out? Well, I just don't know if she would understand the business side of things. She's just thinking, I need money.
Yeah. Now, I always think it's great to communicate and over communicate these types of principles. And as a leader in the practice, our hope is that we can communicate these principles, which are complex, in a way that's easy for team members to understand and digest, right?
Sure.
Excuse me. If I would, yes. So to answer your question, yes, I would try my best to explain the situation. If that doesn't resonate with whoever you're talking to, and they just simply want more money, then that's a deeper rooted issue. If that was the case, then I would start to ask more questions about, well, what's really going on here? Like, you're already getting compensated at the high end for your skill set. We have all agreed as a team that dental assistants that are performing these skills make this range, and you're there. We've already decided that if you're going to do some additional training, then you should be compensated for that. And we've agreed upon this amount. And if you're still asking for more and you understand that it's fiscally irresponsible for us to pay you more, what's really going on here? Is it a situation? And again, this, you do you, but in our organization, like, we'll get real personal and we'll say, is there something going on at home? Where is this need all of a sudden coming from, where things have been good and now all of a sudden you need this huge influx of cash? Some people don't like to get personal with those conversations. And I know like the HR people out there are probably, their blood's boiling, but the reality is, at least from my perspective, you need to get personal and you need to really show that you care. And because you're trying to solve a problem, you're trying to figure out like what is really going on here. And that's just something that I ultimately believe in. One caveat to this conversation that we do here, and again, you do you, we do not entertain raise requests, except for once a year. We have a designated time that everybody knows about where we do a full-on compensation review. It's for us, it's in June. So everyone knows that their compensation will be reviewed in June. So if they're thinking about asking for a raise, then they know that will be discussed in depth, in detail in June. But if someone before June has taken it upon themselves to increase their skill set at such a significant level where a raise is warranted sooner than their compensation review, then that should be handled. They should either ask, or better yet, leadership should go to that person proactively and say, wow, in the last 6 months, we've noticed that you've gone from tier 2 to tier 4. You have killed it. We don't want to wait till June to increase your compensation. So we're going to do that now.
I do like that idea. June once. So how did you roll that out to your team, that you were going to review compensation once a year? I love that idea.
Over communicate. So just constantly over communicate. And the hope is it lands well after the 15th or 20th time that you've said it. And even if it doesn't land well, when someone comes to you in October asking for a raise, it's in my mind, I'm thinking to myself, what an opportunity here for me to create clarity with this team member and let them know that we only do compensation reviews in June. And you can give them the documentation. You can reference the handful of times that you had communicated already to the team without being passive aggressive. That's the key. But yeah, just over communicate, right? Pat Lencioni calls owners of businesses or office managers CRO, Chief Reminding Officer. So it's just
I love it.
Just reminding team members on what has hopefully already been over communicated multiple times.
Sure. Wow, that was very helpful. Thank you.
Thank you so much for calling in. And if anything else comes up, feel free to give us another call.
Will do. Thanks so much for your time today, sir.
Thank you.
Bye-bye.
Welcome back to the Dental Lighthouse podcast. We're going to go back to the emails. Don't forget, you can email us, jason@thedentallighthouse.com, and share a question or a comment, celebration, just share, right? And it's a great way to get it in front of me and we can talk it through. I love being able to answer your DMs and your emails if you're not able to schedule a call with us. So this one is from John in Rhode Island. Jason, I have a conundrum I'd like you to help me with. I'm trying to figure out the best setup for my front desk. Currently, I have a scheduling coordinator who is also my office manager. I have a financial coordinator and I have a receptionist. I also have a part-time employee who works directly with insurance. My practice has me and an associate. We have 2 hygienists, currently looking for a third, and I feel like I may need someone else up front, but not sure the different roles and duties of each person. Can you help me? Again, awesome question, and not to sound ambiguous, but it depends, right? So let's go over some basic principles here, and then we can maybe dive specifically into your situation. Theoretically, there's the same number of tasks that need to be accomplished in every dental practice across the country. Let's say there's 100 front desk tasks, and those tasks range from answering the phone, scheduling appointments, verifying insurance, presenting treatment, generating new patient leads, so a marketing task. So let's just for the sakes of this argument, let's say that there's 100 tasks that need to get done on a daily basis to make a dental office hum. You have to then take those 100 tasks and divide them up amongst X amount of people in a way where they're able to do each task at a high level. They don't feel overwhelmed and they don't get burnt out. So most dental offices understand this, and most dental offices will take these 100 tasks and they've already started to break them up. For example, a receptionist does things like greets people when they walk in, answers the phone, confirms appointments. And it's going to be different from office to office. So the first thing that we need to do here is list out every task that you need to have occur at your front desk to make it successful. The next thing that you need to do is divide those tasks among specific seats at your front desk. Now, you use terms like scheduling coordinator, financial coordinator. The terms don't really matter. We use terms like greeter and treatment coordinator, an insurance verification person. Like, that doesn't really matter. So just name them what you're going to name them, and then start to assign specific tasks with each one. We call those tasks their roles and responsibilities. And within those roles and responsibilities, there's daily, weekly, monthly, quarterly checklists. So that's the first thing. And if you're not really sure who's doing what, a great exercise, this will take some time, but it will be so enlightening for you, is to meet with your front desk team away from the chaos of a normal day. Maybe take them out to lunch and have lots of Post-it note pads on the table. And each Post-it note, you write down one specific task. So everyone basically just vomits everything that they do on a regular basis. And each task goes on a Post-it note. You take those Post-it notes and you stick them to the wall. And once you stick them to the wall, you take a step back and you have your team look at that. And then you start to have each team member pull things off of the wall that they either enjoy doing or they feel that they're really good at. And you're starting to allow your team to develop their own roles and responsibilities and their own daily, weekly, monthly, and quarterly checklists. Now, obviously, you can't allow one person to take all the easy tasks, and you can't allow one person to take the tasks that they're not good at. But the gist of the exercise is to make sure that everything gets written down on a Post-it note. And then when you leave that meeting, everyone knows what they're responsible for. It's a really good way to get to the next level if you're not already there. So now the question becomes, do I need additional people? Well, once you go through this exercise or you refine the roles and responsibilities of each seat that you have, either the work is going to be manageable or it won't be. Now, if the work is manageable and they're doing a great job, then awesome. If the work is not manageable, then we have to ask some questions. Is each individual trained up well enough to do the particular task? It's a simple yes or no answer. And if you find that that task is not being accomplished at a high level, then the questions become, are you aware that this is your responsibility? Yes or no. And do you feel like you're trained up well to accomplish this responsibility? It's either yes or no. If they say no, then what an opportunity to train them up. And then another question that I feel leaders fail to ask sometimes, but is a super important one, is are you aware of how important this particular task is? So sometimes I find that our team members are very busy doing things that don't matter, right? They matter, but they don't nearly matter as much as other things. For example, confirming appointments in our particular organization is very important. And that priority should be high up on someone's daily tasks versus something like, well, we don't really have any non-important responsibilities, but I'll try to make one up here. Cleaning the staff bathroom multiple times per day. So if someone is cleaning the staff bathroom 4 times per day because it's on their task list, but they're not confirming appointments, then that's an awesome opportunity to have a conversation, create some clarity. Hey, Mary, it's more important for you to confirm these appointments than clean the staff bathroom a 3rd time. So obviously there's a little bit of humor in there, but hopefully you get the gist of what I'm trying to say. Create a level of priority for the person to accomplish these said tasks. All right. So now let's regroup here. So we have specific seats at the front desk. You call these people whatever you want. They each have their own roles and responsibilities. They each have their own task lists, and they're not managing it well, right? They're overwhelmed. They are telling you that they need help. So how do you decide if you're able to give them help? Well, you had mentioned overhead. How are you going to ultimately decide if you can afford to hire another person? I hate sharing this metric with offices because it's just a guideline, but they tend to go to it a lot. In general, for a bread and butter dental practice, that's, when I say bread and butter, we're doing fillings, we're doing crowns, we're doing some endo, some surgery. Appointments are typically an hour. You want to be able to produce on a monthly basis $20,000 to $25,000 per non-doctor employee, right? So in your situation, you had mentioned that you have 4 front desk, you have 2 hygienists, you have assistants, I'm assuming. Let's assume that each of your docs, you and your associate have 2 assistants. That's 4 assistants. So we're talking about 10 people. So with your team of 10, or 9.5, because you have a part-time person. With your 10 people, in theory, at a bread and butter practice, you should be producing $200,000 a month on the low end and $250,000 a month on the high end. Remember, $20,000 to $25,000 per non-doctor employee per month. So if you're not there, then you really can't afford to bring on another person. So what are some things that you can do? Well, you can look at your systems and make sure that you're working as efficiently as possible. A great example is hygienists. Hygienists in our organization take payment in the back. They make recall appointments in the back. So when the appointment is over, the hygienist simply walks the patient out. There's no bottleneck at the front desk. There's no need to sit in a line and wait to be walked out by the front desk. If you're currently not doing that, that would be a great way to free up front desk people. So you can walk around your office and look for examples of how you could be more efficient. Another way is to make sure that stuff like insurance verification is possibly being done either off-site or in a room where the team member is not consistently bombarded with the phone ringing, people walking in, and they have to hang up with the insurance company when they're trying to get a verification. So little things like this are ways where you can ask yourself, where are we not nearly as efficient as we need to be? And how can we get more efficient? So hopefully that answers a lot of your question. Hard to really dig into the details without getting your specifics, but I do appreciate the email. Hopefully I gave you some things to think about, and feel free to reach out, schedule a call, shoot me another email if you have follow-up questions. Thanks, Mark.
Thank you. That wraps up another episode of the Dental Lighthouse podcast. You have a choice today. Choose to be a lighthouse. Lighthouses are powerful and steadfast. They are beacons of light for others to reference when life gets turbulent. Go out into the world today and become a lighthouse for someone. Give more than you get. True joy comes from serving others. Start today. I'm Jason Tanoory, your host. Thank you for listening to the Dental Lighthouse podcast. For more information, podcast show notes, or links to anything that we have discussed today, please check out our website, thedentallighthouse.com. We would love to hear from you. If you would like to get on the show, please email us at podcast@thedentallighthouse.com.